Hi, welcome to another video by Alex. My videos are about my prolonged withdrawal and the health effects of being on psychiatric medication. I refer to them as hard drugs to differentiate them from my experience with street drugs. A lot of people think of cocaine and methamphetamine and heroin as dangerous drugs. I've done street drugs, and I've done Abilify, Seroquel, Geodon, Effexor, and Lexapro, Klonopin, and Valium. And if I was going to relive my life and had to choose from basket A and basket B, which drugs caused me more trouble, which did I consider harder, more dangerous, I would certainly choose the pharmaceutical grade drugs as the hard drugs. So I refer to them in these videos as hard drugs, and on occasion I will talk about recreational drugs as street drugs. What I wanted to talk about in this video, I'm sort of getting my feet wet here on the YouTube video thing. I don't have a very good computer, so I wonder how these videos look. I haven't looked at them really on YouTube, but that's okay. I'm not trying to, I don't really expect anyone to even watch them, so I don't care how they look. But what I did want to talk about today in this video is sort of the controversy that is starting to brew about I guess it's the disappointment. It's 2011 in the United States of America, and the sort of situation with mental health. Well, let me talk about it in two ways. There's people like me. I got started as a teenager in the game of mental health, so I was mostly with private doctors and pretty good clinics, because I guess I come from a sort of a middle class family that through the years became upper middle class, and then sort of upper middle class. At least my father, who was divorced from my mother, and it was a big part of the problem for me in the beginning. But because of that, and because I'd have to get my dad on the video to explain it to you, some of the decisions he made. But when he was no longer really present in the house with me, and he became very sensitive to the idea that, like, he would be a bad dad. So he's been really supportive, to my detriment, when it came to funding my prescriptions and sending me to doctors and psychiatrists and inpatient facilities and things like that, which in retrospect didn't benefit me at all, and it would have been better if he had not done that. But I guess it made him feel better because he thought it was the right thing to do at the time, and that's what people were telling me. Excuse me. So one of the things I want to make this video about is controversy, right? So it's 2011 in America, and remember, like, Elizabeth Wurtzel, she wrote Prozac Nation. God, that had to be like 15 years ago, maybe a little more than that. And I remember, I think it was Prozac was on the cover of Time or Newsweek, and these wonder drugs, and Nancy Andreasen wrote these books, about them. God, I forget. They both had brain in the title. See, the problem is my brain got subjected to the recommendations of folks like Dr. Andreasen, and so now I can't remember the name of her book title. Broken Brain, maybe, something like that. And then the sequel, like Broken Brain 2 Electric Boogaloo, or whatever it is. But so what I hear a lot about because I've been plugged into this whole mental health scene since I was 18 years old, or even younger than that, and I'm 32 now. And not just the mental health scene, but a lot of self-help, because one of the ways that one of the tragedies of my drugging was I became an alcohol abuser, and then briefly my impulsivity just went through the roof, and then one 6 or 8 month period, just reckless spending, hard drugs, or street drugs, which put me into contact with a whole element of society that most people don't ever have any contact with, unless they are that element of society. And then just insanity, really, just impulsive, reckless behavior. And I'm not really here to do a tell-all, so we'll just leave it at that. But in the aftermath, you sort of look back, because of all this affiliation I've had with Alcoholics Anonymous, Narcotics Anonymous, Dual Recovery Anonymous, mental health professionals, therapy groups, and all of this. And so, now I finally, in the last couple of years, was able to find, the reason there's a controversy is because enough people now have been put on these medications, mostly antidepressants. People who get put on antipsychotics at the higher doses, they tend to be, they're usually, the ones that I've known, once they get on them, they're usually on them for a long time. And if they get off them, they're pretty riled up. And so they're not real activists. Like most of the websites that I see, the people who are real involved in sort of organizing and making campaigning against what they think is really kind of some cooked data as far as the studies go, and I would say borderline corruption and collusion, sort of this subconscious partnership between pharmaceutical companies and psychiatrists who are in a nice sort of situation where they can get people on medication that they become dependent on, though they don't like to use the word addicted, because they're the authorities, they get to define these terms, and so they're technically not addictive by their definition, but you can't stop taking them. So you just, I guess dependent is a reasonable compromise, but maybe even some psychiatrists would be offended by that idea. In any event, the controversy that sort of emerged in the last couple years is, are these drugs even useful, specifically antidepressants? And you know what? That is a question that I am not going to try to answer, because in my case I've had so many problems from my drugging or taking drugs. I don't want to make myself too passive in all this, but I really want to stress I was put on drugs, large amounts of drugs, when I was 18 years old, and I made a couple attempts to stop taking them when I started to think something was amiss, and went into these horrible withdrawal syndrome, and my doctors just told me that it was more evidence that I needed the drugs, and me having no counterbalance to that point of view, it just was like, okay. And that really got reinforced. And as a young man in my early 20s and late teens, to just have no one offering any opposition to that point of view, it really didn't occur to me. And plus, I was under the influence of a lot of medication. I mean, I would take 5 or 6 milligrams of Klonopin a day. I mean, that exceeds, I think they're called Genentech now, but Roche's maximum dose. And even the maximum therapeutic dose is really only intended for a matter of weeks. I was taking it for 8 years. I didn't miss a dose. You can't miss a dose of those medications, because if you do, you're going to have a bad day. And if you go too long, you're going to end up in the hospital. If you're taking 5 milligrams of Klonopin and you just stop. So my thinking wasn't very clear, and I couldn't understand my behavior at the time either, the impulsiveness and the recklessness, and it was very confusing. At one point my father asked me if they thought I had a brain tumor. Unfortunately, I had already had an MRI, a cranial MRI, and there were no brain tumors, but my father wasn't good about keeping up on all that kind of thing. He was good about paying bills, though. So, one of the things I'm doing here as I record this video is I'm sipping on hot water that I had put about a teaspoon of ginger in a tea bag and soaked it in it. Just ginger you buy at the store, and I sliced it up and steeped it for 2 minutes maybe. The reason I mention that is when you're in my shoes and you stop taking psychiatric medication, you will become, well, actually, I'm not going to use the second person. I'm not, this isn't Bright Lights, Big City, which is an interesting book. But when I stopped taking the psychiatric medication, I became real sensitive, hypersensitive. And it's not just to medications. Like, for instance, one time I took like a hydrocodone pain pill, and even when I was a drug addict, excuse me, I didn't have much of an affinity for pain medication, but I found the effect was just unbelievably potent. Anyway, I mention this because I'm sort of drinking ginger tea on my video, just to sort of show you just sort of what happens to me when I deal with this sort of hypersensitivity, and how something like water with a little that had been made into ginger tea can really just affect me. And ginger is not one of the major things that does affect me. But yeah, it certainly will affect me. And the reason I do that is because I want you to see the way in which my body has been disordered in such a way that things that didn't used to really affect me, like coffee or ginger tea or vitamins or whatever, can really affect me more than even like street drugs would, or things like that. So, but talking about the whole controversy of psychiatry these days, you get into questions of, well, do these medications, do they help anyone? And honestly, I'm not really sure that I am willing to say that they don't. All I am trying to do in these tapes is share what has happened to me, and I hope other people will learn from it and draw their own conclusions, and hopefully the one thing I hope that they will do is do some research. And I specifically hope that if anyone ever sees this, the main I guess demographic that I would hope I could capture the attention of would be parents of teenagers who think that their child, especially single moms, who have a tough situation, and they have a kid, and they're thinking maybe the solution is that he needs Adderall or he needs Prozac or whatever he needs, you know. But anyway, back to the controversy. I will say I've done more than a fair share of research into the matter, but I'll also qualify that by saying my cognitive abilities are not what they once were. So, and I have no formal training in statistics, in reading, in research, in medicine, or in hard science. I guess I'm a bright enough guy, but 15 years of hard drugs and street drugs, I'm not so smart as I once was. So there is reason to be concerned. And I think you see that now, where I think the big pharma, Abbott and Pfizer and AstraZeneca and Bristol Myers, Glaxo, are probably going to shift away to something different than this path model, because the serotonin drugs were just this false. I mean, looking back on it, it's so clear. It's like it's almost a cliche that we all fell for it. It's happy pills. We've got this medication. You're sad, or you're having trouble adjusting, or you're shy, or you're terrified, or you're whatever it is. And I'm really not talking about people who were headed for an asylum, true schizophrenics or something like that, which are, a very small part of the population, and it's really not who I'm addressing. But, I think I've seen a statistic, 1 in 10 Americans takes antidepressants regularly. So, that's shocking, honestly. Especially if you think of the demographics of the country, age-wise, and who would really be appropriate to take them. There's a huge percentage of middle-class and upper-middle-class people who are taking these pills every day. And do they help? Do they? And I know some people who believe they do. Like I said, I have a lot of experience in sort of the mental health scene here, and there's a group, NAMI, the National Alliance for Mental Illness, is what I believe the acronym stands for. And they mean well, and they advocate medical intervention, psychiatric, pharmaceutical intervention. And they're also heavily funded and subsidized by the big pharmaceutical firms. But, meaning well and doing good things are not the same thing. You don't measure the achievement of the accomplishment by how good someone's intentions were. So getting back to sort of the theme, we all had this hope, right? 20 years ago, I was just a kid, but people in medicine, in business, it was this hope that we've found these pills, these medications, and they're revolutionize the human experience, and we're going to all make a lot of money, and we're all going to be really happy, and everybody's going to drive home. Everybody in this deal is going to, except for maybe the patients, are going to drive home in a Lexus or a BMW, and everybody's going to feel happy about it. It's going to be great. It's hard to really make the case that it's worked out that way. But the last kind of group that I would wish to address on this whole topic of, are psych meds bad, is people, the patients. They use this word consumers, mental health consumers. That's such a stupid word. You could affix that to everything that you pay for. Like if I go to a basketball game, I'm a professional basketball consumer. So anyway, that's stupid. But so people who are patients, they're not consumers. If you're a patient and you're taking a bunch of psychiatric medication, I would ask you to think about things critically as best as you can, depending upon the level of drugging that you're under. Your ability to think critically could be impaired. But let's say you're just taking a dose of Prozac or Zoloft or something. You're having side effects, and you're at increased risk for, a number of things statistically, diabetes and obesity and a number of other things. And if you were going to ask me, should you stop your medication, I would not say, yeah, you should stop your medication. What I would tell you is that I think you owe it to yourself, and I wish to do two things, really. It would be my advice to anyone, especially young people, before they get to my point. The two things I would advise is first to research and look at some of the likely outcomes of being on drugs for the rest of your life, and how that might potentially play out. Because of course it's not fully understood. I mean, the current batch of antidepressants, I don't think any of them are much older than, at least on the market, for more than 20 years, so there's not going to be any kind of long-term data the way there is on Valium and stuff. But still, you can get an idea. And the second thing is, so after you do that research and you look at, okay, well, it appears that these are the risks, then say, okay, how is my life better? Because it should be, if you're taking on these risks, and it's not just the risks. The risks are sort of a secondary factor. The main thing is, since I've started this, I'm spending X amount of money to see a doctor and get this medication, and I'm having Y number of side effects. I don't know anyone who takes psychiatric medication who does not have side effects. They can be worse than my side effects. The side effects that I endured and they've not really resolved in the 20 months I've been off psychiatric medication. The side effects, those side effects were far greater in terms of the damage that they have done to my life than the original problem, and it's not even close. So I would ask you to look at the side effects and think and really say, putting those three things together: my long-term health risk, the costs of just doing this, and then if I do feel better, on less depressed or whatever your symptoms are, less anxious, am I making a good trade? Am I okay with the sexual dysfunction, or am I okay with the weight problem, or am I okay with the sleep problems, or whatever side effects you're having? If you look in the prescribing information for Effexor or Paxil or any of these, Lexapro, whatever, there's only like 100 or 50, common to rare side effects. So you could, it really varies, and so I would take a look at that. So I'm feeling quite a bit relaxed because of this ginger tea. It's helped my throat relax a little bit. So I'm going to stop this video here, and this is Alex signing off.